Can parents pass sickle cell disease to their children? Imagine a tiny instruction manual inside your body that determines your blood's characteristics. This manual is called your genes, and it plays a big role in whether someone might have sickle cell disease. Yes, parents can pass sickle cell disease to their children through genetic inheritance. The disease happens when a child inherits two copies of a specific altered gene that affects hemoglobin, called the sickle cell gene or hemoglobin S. Hemoglobin is the protein in red blood cells that carries oxygen. When the gene is altered, it causes the body to produce abnormal hemoglobin, leading to the sickling of red blood cells. These sickle-shaped cells can block blood flow, causing pain and other health problems. Here's how this inheritance works. Every person has two copies of the hemoglobin gene, one from each parent. Normally, these genes produce regular hemoglobin, called hemoglobin A, but if a person inherits the sickle cell gene from one parent, they produce hemoglobin S. If they inherit it from both parents, they have sickle cell disease. If they inherit just one sickle cell gene and one normal gene, they have what's called sickle cell trait. People with sickle cell trait usually don't have symptoms but can pass the gene to their children. When both parents have sickle cell trait, each pregnancy carries certain chances. There is a 25% chance the child will inherit two sickle cell genes and develop sickle cell disease. There is a 50% chance the child will inherit one sickle cell gene and one normal gene, meaning they will have sickle cell trait. And there's a 25% chance the child will inherit two normal genes, so they won't have the disease or trait. If one parent has sickle cell trait and the other has a different abnormal hemoglobin gene, like hemoglobin C, the child might inherit a different form of sickle cell disease, such as SC disease. There are also other types of sickle cell disease depending on the combination of genes inherited. For example, sickle cell anemia is the most common form, where the child inherits two sickle cell genes. Other forms include SC disease, which involves one sickle cell gene and one hemoglobin C gene, and beta thalassemia variants, which involve different gene combinations. Testing can help determine if someone carries the sickle cell gene. A simple blood test can reveal if a person has sickle cell trait. For couples at risk, genetic counseling is highly recommended. It helps them understand the chances of passing the disease to their children. Prenatal testing during pregnancy can also tell if the unborn baby has sickle cell disease. In summary, sickle cell disease is inherited in an autosomal recessive pattern. This means a child must inherit two copies of the sickle cell gene, one from each parent, to have the disease. Parents who carry only one sickle cell gene usually do not have symptoms but can pass the gene to their children. If both parents are carriers, there is a real chance their child could inherit sickle cell disease. This genetic pattern explains why the disease often runs in families and highlights the importance of testing and counseling for at-risk couples. If you or your partner are concerned about sickle cell disease, talking to a healthcare professional can provide personalized guidance and testing options.